Hello, I'm Dr. Mark Sosinski, and I'm here at the 2026 ASCO meeting in Chicago, Illinois. I want to tell you about three exciting presentations that we saw over the past couple of days. The first is the Libretto 432 study. This was a study in a surgical population, stage 1B to stage 3A, that had RET fusions that looked at the adjuvant use of selpercatinib in a placebo-controlled fashion. Patients had to undergo resection, obviously. They had to be proven to have a RET fusion. They could get adjuvant platinum-based chemotherapy. In fact, 90% of them actually did. The primary endpoint was event-free survival, and that's what was reported. The hazard ratio was 0.17. It was very impressive, and it very much reminded us of the ADAURA trial as well as the ALINA trial. So this is the third use of targeted therapy in the adjuvant setting in a targeted population that shows a huge benefit in event-free survival. The survival results were very immature. There were no new safety signals with regard to use of selpercatinib in this population. So I think that that's notable. And this really reinforces the use of comprehensive genomic testing in early stage surgical disease. The second one was the Wukong 28 trial. This looked at the use of sunvozertinib in patients with EGFR exon 20 insertion mutations. This was in stage 4 disease. Patients were randomized to standard platinum-based chemotherapy versus sunvozertinib in the first-line setting. Again, the primary endpoint was progression-free survival, and there was a significant benefit with regard to progression-free survival, almost a doubling of the progression-free survival in favor of sunvozertinib in this population of exon 20 insertions. The response rate was doubled with sunvozertinib versus platinum-based chemotherapy. And overall survival is very immature, so we're going to have to wait for follow-up with regard to that. But it brings, again, the concept of if you have a targeted population with a molecular alteration, using a targeted agent is more effective than our standard platinum-based or other therapies in this population. Lastly, another plenary session presentation looking at the role of ivonescimab. And this was in the HARMONi-6 trial. This was presented by Chinese investigators looking at the use of ivonescimab, which is a bispecific PD-1 VEGF antibody. They randomized patients, over 500 patients in China, with squamous histology patients, stage 4, to the control arm of carbotaxol plus tislelizumab, which is a PD-1 antibody very similar to pembrolizumab, to the investigational arm of the same chemotherapy, but ivonescimab, again, a bispecific antibody to both PD-1 and VEGF. We had seen the progression-free survival rates last year, which were in favor of ivonescimab. What we saw today was the overall survival analysis, which was in favor of ivonescimab, with a hazard ratio of 0.66. Lots of questions with regard to the applicability of a trial done solely in China to other multi-regional populations. But again, I think this, we've all kind of been wondering what's going to be next after PD-1, PD-L1 inhibition. In this concept of co-inhibiting VEGF in the same molecule is of great interest. Of course, first question is, can this be replicated outside of China? There are issues of patient selection, these sorts of things. But I think the bispecific antibodies, we're going to see a lot more data in the coming years. So to tie this all together, again, comprehensive molecular testing is part of all stages of advanced non-small cell lung cancer to identify these targeted populations in which targeted therapies are continuing to make great gains compared to our old-fashioned treatments. And then again, the use of a bispecific antibody in the stage 4 setting of squamous cell, certainly a relatively unmet need population. So I'm excited about that, and we'll look forward to future trials. Thank you.